Good day, everyone. Thank you for coming to this meeting. My name is Brian Gingrich Jr., and I am the current Associate Director of the hospital here in Toms River with 300 beds. This proposal is here to help the growing geographic area by giving the best care and treatment that our patients deserve, just as they were our family members, and improving daily operations efficiency for the future. Toms River is geographic. So the population here in Toms River as of 2023, according to the United States Census Bureau, is just shy of 96,000 people. And the population continues to grow every year by 1,200 individuals. So by 2029, it's going to be over 100,000 population in the area. Toms River is part of Ocean County, where Ocean County has a total of 660,000 individuals here, which is an increase of 13% since 2010. The median age here in Toms River is about 42.6, and the county age is at 41.3 years old. So regarding Toms River, though, which is known for our retirees and our 55 plus communities, we have about 31.2% of our population is over the age of 55. But then we have disability, which is at 28%, which is related to vision, hearing, ambulatory, and independent self-care. When it comes to health insurance, it is covered. 97% of the town has coverage, where 3.3 either is on the making of getting some type of coverage or is uninsured. And the living situations, there are currently 59 nursing homes and assisted livings within Toms River. So the expansion project, we are going to construct a new building on new space and land that we have acquired here in Toms River, right next to the main campus. We're going to add additional 130 beds, which will make a total of 430 beds on campus. So we're going to add more parking spots for visitors and staffing. And we're going to have easier transfers in the main building to the new wings that we have here in the new project, hopefully. The new building will be about 300 square feet, which is about the size, of the Lincoln Memorial reflecting pool. 120 beds will be towards single patient space. 10 of them will be for operating beds related to pre and post outpatient services. And we're going to include a cafeteria grill for any staff and visitors who want a bite to eat. As well as we're going to add parking garage on the bottom, like 3-4 levels below. It's going to include about 500 additional spaces. And we're going to have a walkway overhead for only staffing only to connect the walkway. Say if the patient has to come from the ED to, outpatient services or needs to be transferred to our inpatient or ICU, that's where they're going to be transferred to. So our proposed goals is to reduce the jam-packed rooms for patients and visitors. Most of the rooms you see in hospitals are usually 2 patients to a room, and it's quite tight, especially if you need to take the patient out for testing or needs to be transferred to another organization or hospital for higher level care. Additional 5% public policy role. some of the policies we'll have to add will be like funding, which to expand a new building we must be up to code and follow policies. When we're using funding, which can be grants, tax credits, utilities. Um, so utilities a little bit different, as you get a return the portion of a payment in the form of a credit or cashback. Goes well with energy services companies such as like the EPA, Energy Star, which will help you save money but also will give you reimbursement as well. You get the Medicare reimbursements, compliance with state and federal, like the Joint Commission and the American Institute of Architects. So the American Institute of Architects, or AIA, has issued guidelines for the science of and construction of healthcare facilities that contain information and standards for construction, ventilation, and equipping new medical facilities. And our goal is pretty much improve access to care and treatment. Projected financial planning and outcomes. So our budget that we have is $2.25 billion. As of right now, to start, we will only probably need $800 million for the construction project. We will then save money to the side just in case we do have changes to increase in budgeting to construction and supplies. We're going to use the remaining of that budget, if we can, to hire new physicians, nurses, techs, so the ratio between staff will be to a safe and minimum, and not stressed out for the staff where they are covering 10 patients to 1. The current patient volume is 1.5 million annually. Project growth is 5 to 10% increase in volume. We are projected hopefully maybe hit like 7.5 if we can within the first 2 years. Our interview for stay is $400 for a 24-hour bed stay. Our outcomes are gaining revenue for beds from both our inpatient and outpatient services, operations efficiency, saving from improvement, and gain hopefully more patients over our competitors, especially in the local area with our new health and care and treatment. Projects, setbacks, and incentives. So some of the setbacks that we might get involved would be like zoning and land use, environmental regulations, financial constrictions, labor and supply chains, which I think will be the where the remaining of our budget will come into play for that, as sometimes there will be a delay in supply where we will have to reach out to other companies to get a delivery faster, but we probably will have to pay a higher cost than we were originally planning. Operation challenges. I think one of the biggest challenges we're going to have too, a lot of the hospitals we have here has quiet zones, and we're going to make sure we're not doing construction during the quiet zones, but also making sure there's safety unseen and we're not going to get anybody hurt. Incentives would be, reducing patient admissions with hopefully better care and treatment. They will not be a frequent flyer coming back in and out. And hopefully with how great our services are with the new wings that we have in this new building, we'll have increased demands from a growing capacity. The conclusion is that we should have the project approval, um, that it is continuing to grow in healthcare and to take care of the local community needs and long-term success. And the reason why I think this is going to be successful is the patient volume and revenue. Increase the staffing for our nurses and patient. That's a big deal, especially for safety and just setting our goals and financial policies and financial. And this is it. Thank you for your time. I'll have a good day.